Hello, and welcome to Everyday Creation, the show about living our purpose, lifting our vibes, and expressing our creativity for the highest good. This is Kate Jones with the third excerpt from a longer interview with family medicine physician Adeola Fakolade, MD. In this episode, Adeola talks about lifestyle medicine and prevention. One of the things when we had our previous conversation, you mentioned something about a shift in U.S. healthcare that's coming. Would you talk about that?
Yeah, so right now, the US is in a little bit of what I consider a transition period. Traditionally, care of patients has been sort of reimbursed on a fee-for-service basis. So you get paid on the number of patients you see. It doesn't really matter how well they're doing or how well they're not doing. You just get paid. You see one patient, you get X dollars. You see two patients, you get X times $2. You see, et cetera, and all of that. But right now, the United States is sort of switching towards more like a pay for performance model where you get paid based on outcomes, especially in primary care. It's just like your patients that have diabetes. How's their diabetes doing? Is it well controlled? Patients that have high blood pressure, how are they doing? So it's shifting more from a quantity to more like a quality payer perspective. Because again, we're in that transition period, we are we still have there's still a lot of vestiges of the fee for service model, and then we're trying to fit like the quality model into it. So there are some growing pains, as with anything that is new, but I think that is going to work itself out over the next decade or so. I'm also board certified in lifestyle medicine, and lifestyle medicine sort of focuses on prevention essentially, and it focuses on like lifestyle choices as sort of medicine. There's like six core pillars. There's nutrition, there's exercise, there's stress management, there's social connections, and then making sure you're getting enough sleep, and then substances as well. So just in general, seeing that shift in the US to more prevention focused, more outcome based than just fee for service, which I think is good for everybody. It's a bit of an adjustment. I think for the patients, really for all the players in the healthcare system, talk about insurance companies, the physicians, everybody. But eventually, I think it's all going to be fine. It'll settle in. We'll settle into it eventually.
I'm so happy to hear that it's going that way. That is terribly important and not have, just managing with medicines all the time and everything, because by the time you get to that point of needing medicine, there could have been so many other things to do before that time.
Yes, I agreed. I agreed. The average person, and this is just, like my personal opinion, obviously, yes, there are people who are born with certain conditions, congenital conditions, but the average person, I think, if we kind of focus on lifestyle medicine and prevention, if we do it right, that person hopefully is not going to need a lot of specialists. That person hopefully just needs like a primary care physician. That's it, who is like keeping an eye on their health and kind of helping them stay healthy throughout their lifestyle, if it's done right. So,
Great. This is Kate again. If you want to hear more from Adiola, you'll find the other episodes listed in the show's description. Thank you for listening to Everyday Creation, and please share as you wish.